Hello, I'm Robert, a fact checker and science blogger, and I'm going to talk about what Bruce Aylward said in his press conference yesterday, or was it the day before. Anyway, I'm astonished that hardly anyone seems to pay any attention to it. And you go online and you look at the YouTube videos, and you get these people just commenting on his appearance and his style of presentation. And they just don't pay a blind bit of attention to what he said. And I went to university with many academics, and they just talk like he did. He's just absolutely typical academic, expert on his topic, but because he talks like an academic, then people just weren't listening to him. So I hope by using somewhat more ordinary language, a little bit simpler words, and just talking in a slightly different way, then I can help you to listen to what he actually said. So it seems very silly because he's just given this great presentation, but that's what I'm going to do. And so, for better or worse, I'm going to just go through and just say his main points. So, he said there are three big questions. What have China done, and how have they done it? And extremely important for where we go next with this. What the impact of their approach has been. So that's three things. What have they done, how have they done it, and what is the impact? And then some implications as we go forward. And then he talks about how the whole thing was a request by the President of China with Dr. Tedros, head of the WHO. And the China's done such a huge amount, and they feel that what they've done, they've learned so much, and they think it can inform the global response. And as well as that, they are very keen for their own response to have an independent mission to come in and review it and assess it, and assess independent of their experts of what has been done and the lessons and the way forward. So this was an international team of 25 people. There were 13 international from outside China and 12 from China on the Chinese sides, integrating into the team and leading the response. And he was the head of the internationals, and then on the Chinese side was the head of the expert team in China. He gave a name, but I can't remember it. They started in Beijing, and they met Saturday, kicked off on Sunday evening, and they met at 7 p.m. at night, went on to midnight, and it was typical of their working days. And he said he had a bit of sleep deprivation, and he's been having these long hours, and so have these people there, just going on to late at night, then up again in the morning, and just working all the time. And he said they went around to the national institutes and the municipality, right down the community level, to see how it works with case finding, contact tracing, and to speak to the physicians and the contact tracers themselves, get an idea of what's working and isn't, and how things have gone over the last 6 or 7 weeks. And from there he went, I'm not sure I got that name wrong, went to a very large industrial province, and then to another province, then went to Wuhan for a day and a half, and towards the end of the visit. And in all the places they saw the facilities, the contact tracing, markets in a couple of places, railway stations, airports, clinics. They went everywhere. And they asked hundreds of people, thousands of questions, often from different directions. And this is really important in a crisis like this. It's only 6 weeks in. And the people they met, they were exhausted, they had huge amounts done, and everything was changing very fast. And so it was difficult for them to actually build what had happened and how it looked like. And that took a fair bit of time because they were trying to work out what had happened in the past while interrogating these people who were very tired and working very hard, and things had changed so much. And so he gives a tribute to this team and to the people. And he says that he has not briefed Dr. Tedros, he is totally independent of the WHO. Dr. Tedros has not yet seen the report. Hopefully it will come out soon. And the international and the Chinese have been working very closely together, finishing the report, and it's being submitted to him right now. So first, what had the Chinese actually done? They approached a brand new virus that had never been seen before. It was escalating and quite frightening. and in January, and they took a standard and old-fashioned public health tools and they applied it with a rigour and an innovation on a scale that they had never seen in all of history. Never in all of human history has this ever been done. They took case finding, contact tracing, social distancing and movement restrictions and used that to try to stop a new emerging respiratory-borne pathogen. And as most of you know, when they're planning for flu outbreaks, most of your thinking is just to buy some time to get your vaccine rolled out. And here, there was no vaccine or therapeutic, and unlike a flu pandemic, no chance of getting it very quickly. And this is my aside, I do occasional asides. And the Chinese took a very pragmatic approach. We're going to go after that virus using those very traditional tools. And a lot of people in the world, and on his team and he himself, were very concerned, and they thought this is just not going to work. Because it runs counter to normal thinking. With a respiratory pathogen, the idea is you would actually find the cases, isolate them, do the contact tracing and achieve that kind of outcome. But that is what China did. And as we dug into this very systematic approach, there are 5 things, and some different, and all impressive and critical, that they did to make this work. First, they had a differentiated approach. They realised immediately that you can't do the same thing everywhere. If you think about everybody normally thinks about the lockdown of Wuhan and think that all of China, that they had to just lock places down. And so they didn't do that. They had a differentiated situation. If there are no cases, if there are sporadic cases, if there are clusters of cases, or if there are community transmission like they had in Wuhan, so a different approach. And this was important. Lots of people had said in advance, you can't do this at scale because you will exhaust your response. Because there's only so much you can do with the facilities you have available in a country, even a big country like China. At some point you're going to exhaust the response of what you can do. And so the Chinese pragmatically said, no, you're not going to exhaust your response if you tailor it properly. So that was the first thing they did. So different responses in different regions. And then they mobilized phenomenal collective action of the people of China. So people comment on to him that this is easy to do in a political system like China. No, it isn't. Because people have to actually want to do this. You have to get the passion, interest, duty, an individual sense of duty that it is their duty to stop this virus. And he says that they spoke to hundreds of people in hotels, on trains, on planes, people who were quite outside the system. And they all had this responsibility and this accountability that they had to be part of this. And he said the most stunning demonstration was when they pulled into the train station in Wuhan. They had a special train. And it's the saddest thing in Wuhan. The train just roars straight through the stations. The big intercity trains going through this big city of 11 million people, like going through Birmingham or something, and the train just goes straight through with their blinds down. And the people living in Wuhan surrounding them just watch the trains go zooming past, and they can never get on. And they were the only train that stopped. And as they got off, they thought they were the only people allowed to get off, but then some other people came off with flags, and it was a medical team from Guangdong to be part of the 40,000 healthcare workers from other parts of China who many volunteered to go to Wuhan to help with the response. And the striking thing, as you pull in, and then you drive through Wuhan to your destination, and you just see skyscrapers and boulevards, and it's a ghost town. It looks like it, but behind every window, in every skyscraper, there are people, and all those 11 million people in Wuhan, they're cooperating with this response. It just couldn't work without 11 million people cooperating. Just staying at home at night when there would be you normally going around doing all their things, and they're just silent at home. They're just at home, staying at home. And behind every single window, there are people cooperating. And people say that there's a big presence stopping them. No, there isn't. It's totally invisible. There aren't police out in the street with guns or anything like that. It's just cooperation. It's staggering. And every person they talk to there has a sense that they're mobilized like a war against this virus, and they're organized. Collective action. So the other thing was repurposed machinery of government. And so people say transportation does this. So by transportation does the trains, the toll booths, the checkpoints. The agriculture does this. Makes sure the food is still produced and it gets to everyone. The forestry people do this. But everyone has a role, and it's been repurposed to fit into this machinery, all repurposed to fight the virus. The prevention and control task force and through a system of government. And then technology turbocharged their response, big data and AI. So he said it was striking that nobody in China uses money. They just pay with WeChat on their phones. And big chunks of life is lived online in China already. He hadn't appreciated that from a distance. And for this response, they had to manage massive amounts of data. It's hard to find every case, trace every contact of 70,000 cases over vast areas, then a map and link to other sources of data. And because of sheer numbers, the Chinese had to take whole hospitals out of service and make them into response hospitals for COVID-19. Take the major hospitals in a city and repurpose them, and not just one hospital, multiple hospitals they had to repurpose for this response because there's so many cases. So there were some designated hospitals for regular patients, obviously, and they delayed a lot of things like elective surgeries. And then a whole chunk of work then is they have 50% of consultations are now done online. So that moved a whole bunch of what is normally done physically, moved online to keep the regular health services going, prescriptions turned over in a very orderly manner. So that saves half the people who are coming in to your hospitals. And on top of that, and so that frees lots of space in order to be able to clear one entire hospital and move all the patients to another one. And by just taking away all these people that are coming in every day on most hospitals, they're just doing it online. On top of that, there's everyday life. And you've got to feed 50 million people. You've got to keep the food moving. And they do it by all the deliveries are done online. So just stop and think about that. Wuhan, 11 million people, nobody going out shopping. They all are doing their shopping online. And then they have vast numbers of people on motorbikes going around delivering all these deliveries. I've seen videos of them doing it on YouTube. And so people are ordering online and then getting things delivered to their apartments by these people all suited up and everything and doing the deliveries. And then the last bit of this is equally impressive, how science-driven the response is there. 8 weeks into this, and it's evolved so fast, China issued its 6th set of guidelines, turned over 6 times in 6 weeks. And then every place they went, we asked what guidelines are you using, and they all said, we're using the 6th guideline. How is that? It came out yesterday. And this speed of turnover, to stay on top of that, all the staff learning the 6th guideline immediately as soon as it comes out. Science-driven, very agile at a phenomenal scale. And what they did, contact tracing with an extraordinary rigour, technologically powered and science-driven. And remember exponential growth. Every place it is hitting, you see exponential growth again. Like in Italy, we're seeing it in Italy, and so I'm doing these asides just to fill in little details. So like we're seeing it in Italy just now, and we're seeing it in South Korea, and you get this exponential growth again, and you get this debate on TV, is this a pandemic or not? And you get a rapidly escalating epidemic in many places, and we have to tackle it fast to prevent a pandemic. And China showed that where this goes is totally under control of our decisions to apply this kind of rigour and approach to this disease and outbreak. It's our decision It's not the disease's decision, it's our decision. And there was a lot of latitude, big rules in place, but the provinces, counties, towns could adapt to make it work for them. The fundamentals the same everywhere, but the details differed. And then people would ask, what about rural areas? In Szechuan province, again, I don't know if I spelled this properly, these are just my draft, quick notes I typed as he was talking. And then I've done this, a little bit of replaying again and transcribing bits, important bits. So I had teams out there all over the place in the rural areas doing investigating and contact tracing. But how do you know it's working? And so one governor explained to them, we made a decision as we rolled out 5G, we made a decision to make the connectivity with rural areas work so we could run the COVID response in real time. So it's all 5G powered. They have one big screen on the wall and transmission chain of the new centre. And then when he was there was a problem. And they said, can we speak to them? And again, there was a question. They brought the team out in the field and trying to do this. The whole thing was contact. So he explained that they had, I haven't written it down very properly, they had like dots on a map. So they just had not a paper map, but a screen. There was a map of the countryside and the little dots. And there was, these dots represented all the contacts that they had. That they chased up 500,000 contacts over China, and each of those would be a dot on a map, so you know everywhere exactly where this person is at all times, with their GPS and a dot. And so say, here is this contact, and then the people go out and they go and visit that contact and talk to them, and then these would be all these dots for the team, and then the team would be there and they'd say, we need to talk to this team about this contact. So they just talk directly to them through 5G instantly. So there was a problem, and they said, can we speak to them about this particular contact? And they said yes, and they brought up the team out, and the whole thing was linked up in constant contact with everyone. So what's the impact of this? Well, it was astonishing. Obviously exponential growth outside, and there's unanimous assessment of the entire team that they have changed the course of this outbreak. A rapidly escalating outbreak has plateaued and come down faster than if we looked at the natural dynamics of an outbreak like this. It's striking. He said he'd never seen anything like this in his entire working life. So here he is showing, this is Wuhan, it's going up like that. It was nowhere near the entire population. You would expect it to just keep going up and up like an exponential, eventually to level off and then die away, sort of months later. Instead, it just goes up to there, and then it dies away. And he says he's just never seen anything like it. And you can tell by the shape. If it's a normal one, it's a normal outbreak. So if it's symmetrical, it should be symmetrical if it was just a normal disease. Instead, it's got this asymmetrical thing because they cut it off short. Instead of going up like that, then like that, which you would expect. Then it's going like that, and then it's going off at a slight shallow angle. And this is just, he's never seen anything like it. Exponential growth at a rate and then coming down more slowly. The intervention has definitely changed the shape of this curve. And it has, and later on he says that they have saved hundreds of thousands of people from infection by doing this very old-fashioned approach, as it seems, with extraordinary rigour. Interventions change the shape of land. Seriously? You're going to change that? And they did. So yes, he said hundreds of thousands of people back at the end full of calculation didn't get the infection because of the response. And any time you do that, you're also going to reduce the potential for it to go elsewhere. Imagine if there were 500,000 people in China, that would be no surprise at all, who had it because they didn't contain it. Then, compared to the number we have now, which is tens of thousands, then it would be far harder there would be far more people, you'd have been 10 to maybe 5-10 times as many people would have been leaving China with the disease. and we had 5 or 10 times the size of the problem throughout the rest of the world. This is what could have happened. And it didn't because of China. And this also we heard everywhere in China. It's our responsibility to do this for the world, not just for them. We heard them quite a number of times. And you get people saying, China, they're authoritarian, they're just being horrible to each other or whatever. These, okay, they have human rights problems, they have all sorts of dreadful things like it seemed to us, but they are human beings. And these are doctors and nurses. And the doctors and nurses, they go into their trade to help people. They are there to make people well. Of course, the doctors and nurses are going to want to help to stop deaths in the whole world, not just in China. And the ordinary people there, they just have ordinary compassion like everyone. They want to stop the disease in China, but in the whole world, and they feel a great responsibility to the world, not just for them. He said, we heard that quite a number of times. They are in it in order to prevent this disease from going out to the world. And then we get people talking a lot about these numbers, and he said, what we as epidemiologists is interested in, not the exact number, but the trend. Is this real? Is it level? Is it going up? Is it going down? So they had multiple ways to get a sense of where the trend is going. So there's those curves from the Chinese case studies. But another way is to talk to doctors who are seeing patients who are running these massive hospitals. And everywhere they went, they were hearing the same thing. We have open beds. We get people out of isolation centres where they've been just quarantined into a proper hospital bed. The system is opening up because the number of cases is going down. They've also established fever clinics. You go there and assess you very quickly. And they have CTC scan that quickly assess you whether you've got telltale marks of COVID-19 disease. Amazing story itself. Now, I've got some links there to that actual story about the CTC scan. So this has been published. What they found was that actually, if you do a quick CTC scan, you can detect COVID-19 several days before you can do it with genetics tests. China discovered this already some days ago. The rest of the world hasn't yet caught up on this. And if we can rush out these CTC scans, we can catch the infection much earlier. We can catch it before the symptoms show. Apparently, you can see what the virus has done to your lungs before you feel any symptoms with a CT scan. And this is one of the things that China can bring to the world. They've discovered this. Nobody else seems to have taken this on yet. And this obviously makes a huge difference if people start doing it. They start catching the cases. And not only that, they get 97%, I think, of the cases 2 or 3 days before the PCR results come out. And it's almost 100%. I don't know, it's pretty much, I can't remember the figures, but it's pretty much totally that they don't get any mistakes. They just get nearly all the cases. This makes a huge difference, and it's part of the reason why they're able to bring it down. And so that's especially for the contact tracing. So once you've got an infection, and you go and trace up all the contacts, they should be using CT scans for all the contacts of everyone that is infected. They shouldn't be waiting for the PCR things. And that's what these fever clinics do as well. If anyone gets a fever, they should get a CT scan. That's the very first thing they do. And to do that, the people in China, they have got very fast operation of their CT scanners in order to get pushed through loads and loads of cases. And this is what we should be doing. We should be gearing up to do this. People to, also CT scan, but also training people to be able to very quickly use the CT scan in order to assess these people with COVID-19. And this will make a huge difference. It's just not being done yet. And at one point, 46,000 people a day were being tested, and then 13,000, and now they're getting the P4 with these CT scans. That's a lot of CT scans to do per day. and 13,000. Then you're talking people with fever panic, people, and they're not testing people anymore. They said there used to be lines, and now these people who were lining up for CT scans, they no longer are. And they have gaps in the day when there's nobody coming in for one. So this again shows they've managed to get the cases down. And so another example, then someone, Charbin, I don't know if I brought that right, someone's doing this trial of the anti-HIV medicine, and they did it in Wuhan because you have the highest number of cases, you can get the fastest enrollment. In order to do a proper clinical trial, you need lots of cases. You need the patients to consent. Maybe not everyone consents. So you need to go in a place with lots of cases. And so he asked them, how's it going? And he said, it's slowing down. We're not getting enough new patients that we can recruit into this trial. So, and so is this real? Is it possible to stop a disease like this without a vaccine and without drugs that can stop people getting infected? And the answer is yes, it can. And so I've got new reports in new areas. Then have you got 100 beds? So people saying, oh, it's hopeless. Like I've heard that the German health minister apparently was on BBC saying it's hopeless in Germany. I don't know if that's true. It may have been misreported. But if so, they're giving up far too soon. You should say, have you got 100 beds where you can isolate people if possible? Have you got a wing for a hospital that you can close off? He explained later on that in China they actually walled up the end wings of hospitals to properly quarantine them. They, I'll get to it, I might as well say it now. They took stadiums and big community centres, and they filled them up with beds, and they made them into isolation wards in 48 hours. So we should be thinking about that around the world, in UK, in Germany. Where can we get all those beds? Who are we going to order them from? Who's going to supply them? Which is the stadiums that we can convert? And how can we change operations, and how can we do this very quickly? Because you've got to stop your epidemic as quickly as possible. If it continues for another 3 days, it's going to double in numbers. If it continues for 6 days before you've got everything together, you've got 4 times the original number. So you've got to, and if you can get it right away on the first day, you have very few cases. So if you start getting large numbers, if you can immediately get everything set up, and you know where you can free up you've got a hospital wing already marked out, you know how you can free it, you're able to very quickly just tell everyone that you have to postpone elective surgery, and we then move these patients, we know who's we're going to move and why, and then this is the wing that we're going to make free. And you've got to have those plans in advance. If you've got them in advance, if you're ready in advance, then when it hits your country, you just go in and do it. Nobody knows what to do. And within hours, you've got your wing set up. And within a day or two, you've got your stadium where you can have maybe 1,000 patients if you need be, sitting in quarantine. So this is what we should be doing right now. Not actually doing this, but have all the plans ready. You've also got to have all the contact tracers. So if you suddenly need 1,000 contact tracers, where are you going to go? Which company do you know that can supply you with 1,000 contact tracers to trace all the contacts of all the patients? And will you be able to do that? Or are you going to be delayed for a day, and then another day you go to one company and they say they'll do it, but then it turns out they're not as good as you thought they were. You have to go to another and another. Or have you figured it all out? So you just go, oh yes, okay, hi blogs, hi Joe, or whatever, we now need you for the contact tracing, and say, yes, I've got my 1,000 people, I knew you wanted 1,000, I've talked to them all, and they're all ready to go. That's what we need. And then he showed another graph, even more striking. So that's the one for Wuhan. This is the total population. This is Hubei province outside Wuhan. And then this is the rest of China. Now, I think most of you will know that the rest of China has much larger population than Wuhan. If this was a normal epidemic, you see it starts off very similar at the same time. But if this was a normal epidemic, then this would be much larger. That'd be way up like that. And so it's another very striking image that shows absolutely that it's not like a normal epidemic. Not at all. They have managed to contain it in the rest of China. And he said later that just the day before his presentation that 24 provinces of China that used to have many new cases each day had all reported 0 cases for the previous day. This is the basis on which the China say that they're close to containing it. Yeah, there we are, 24 provinces, and 31 provinces, in fact only 3 weeks ago. Each of these provinces is as large as many of the countries reported recently. Each of these provinces, like Germany, who had thousands of cases, some of them, and there are just no new cases per day. So, where do you go next from China? Well, China were not acting from scratch. They had the SARS outbreak in 2003, and back then they realized they needed surveillance for unusual clusters of pneumonia. So people keep saying, oh, the Chinese hid it. They didn't. They discovered this well before most countries would have discovered it. And okay, yes, there was a local doctor who sort of said, it looks to me, is this a bit like SARS? But you've got to bear in mind that how many times has a doctor said, oh, we've got a cluster of unusual pneumonias, this looks a bit like SARS, throughout China when it wasn't. And you only noticed it a day before the actual outbreak, the actual detection using their surveillance system. So a very efficient automatic system that found the unusual cluster straight away, as soon, just a day after the person and the local doctors were beginning to wonder if it was a bit strange. Very, very fast. So they had time and experience to build this system, and having seen so much they've done, it was very humbling for him to be asked by them, what do they do next? A lot of it is about reinforcing what they're already doing. So vigilance, the case is not down to 0, a lot of it needs to be dealt with, so they've got to keep on being vigilant. And people who get sick in hospital, then they are in hospital anywhere from 2 to 6 weeks. So you have all these sick people at the time, and a lot of sick people are still in hospital or isolation or holding centre, like in the graph at the back there. Then a lot of these people here, they're still in isolation, and they'll be there all the way through to there. Thousands of people are still in these isolation centres and needing, and actually literally thousands on ventilators. And they're going to be there for some time, possibly up to several weeks, up to 6 weeks. And there are just over 50,000 people still recovering. And then he goes to the spectrum of the disease, the graph by the CDC, and he explained this spectrum thing. So these are the mild, what normal he called that or something, the critical, the severe and the critical. And the severe are the ones, the critical are the ones that have got like multi-organ failure and they're really in a bad way. The severe are and ECMO and stuff. The severe would be the ones that have got needing oxygen, ventilators and so on. The normal and these are the mild ones. I'll just double check that I've got those things right. Let's read them out in my notes. 80% of mild, right. Mild, a fever and a cough, that's yellow. And pneumonia and a little bit sicker, the blue. Severe, usually have respiratory insufficiency, the oxygen saturation is down and the breathing rate is up. Right, that's that. Then the severe, right, yes, we've got respiratory failure, then the severe, like multi-organ failure. I think he said something else. I was talking quite quickly and I didn't get everything down. But his point with this graph was to look at what happens next. So these, just hardly any, the red ones are the ones that die. It's a tiny, tiny proportion of the mild ones. So if you look at I think he's talking about a snapshot at any particular time, and the mild ones nearly all recover, the normal nearly all recover, tiny, tiny amount. In severe, small amount die, and then the critical, then a significant amount die, but still you can see about half of those recover. And again, this is a thing you've got to think about. Nearly every governor, nearly every governor they're not complacent, even though it's going down like that. So he said that they would be very, for instance, someone asked you, has it been contained? He said that they would not like you to say that it has been contained. Oh, I'm off the page again. Yes, they wouldn't like you to say that it has been contained. Nearly every governor is still buying ventilator cases, beds. We don't know this virus. People talk about SARS and flu and not using all the evidence. So they just don't know what's going to happen next. They never have all the way through this outbreak, because the very first time. So even though they've got it all going down to nothing, they still don't know what's going to happen next. But, are all these recovered people, are they going to stay recovered? For instance, can you have a second infection or something? I mean, that was one of the questions he was asked, and they don't know. They don't think so, but they don't know. So nearly every governor is buying ventilator cases and bed, and we don't know this virus. And key points, we don't know. We think we know how to manage, and it won't be another Wuhan. If it gets to 0, then great. But make it here for some time, and we'll try and manage this. So that's a good message for the world. How many countries are planning beds, ventilators, O2 supplies, and lab capacity to manage this? And we should all be doing that. So in the UK, we should have planning in, and the US, Trump was saying that the US has put aside $2.5 billion to fight this. Well, with some of that $2.5 billion, they should be working out these things. They should be making sure that they've got all this stuff in place. Now, I expect the US will, because after all, some of their experts were on this team, and they were expert-led. It was one of the experts, I forget his name, but the expert, there's a question at the very end of his press conference. Then the Trump was talking to his, the people were asking, is Pence going to tell the expert what to do? And the expert said no very clearly, and then he felt it was a great asset to have Pence there, because he's got a big weight in government. So this is, I think we can be reasonably happy that the US, they could certainly do a lot more, is getting this message. We all need to be doing this. And then he said, the third world needs the experience of China. Everybody he spoke to knew what they were doing and had clinical experience. And they had become very striking, just people who weren't trained like CDC, he said, were speaking like CDC experts to them. He just knew everything that was relevant to their virus. And the countries are building barriers between themselves and China, and new barriers are going up as he speaks. And risk in China is going down. So as people are putting up barriers, then China's managed it and the risk is going down. And we need more access to China, and especially access to their expertise. We need the experts from China to be able to go and visit other countries and advise them on the spot and help them. Nurses and doctors and so on. Ones who've been tested and they're negative, and they've been doing it safely. They're not a contact. And then he said for the China, a number of things he's making to basically reinforcing things already happening. But the advice for the rest of the world has to be a shift in mindset. Around the world, people are thinking, how will we live with this? And rather than, this virus will come, we'll find it within the first week, and we're going to find every case, go after every contact, keep people alive, so survive the case. And this is the way we've got to be thinking. We've got to be thinking in terms of finding every case and go after every contact. That's what we should be doing. And not preparedness, we've got to go further than that. We've got to shift to readiness. How do you shift to hospital? Rather than isolation, this thing I talked about, you had a hospital, a wall with a window in it, and the whole 40 beds is now an isolation ward. Just a normal ward, but they put up a wall, put a window in it, and it's now an isolation ward. And an example, the stadium, I told you, 1,000 beds in 72 hours. And between 24 and 48 hours in Wuhan, they increased the capacity by 1,000 beds by using by setting up various community centres and such like. And we're going to try not to have a deal that's like Wuhan's, but we may have to deal with sporadic cases and clusters. And you have to be ready in your mind to stop the transmission chains. So we said the world needs a mindset shift and planning. It has to be done fast. He said the world is simply not ready, as we saw already in Italy. But later the WHO has praised Italy for its fast responses. So it is learning, but it should have learned before the outbreak started. They should have known in Germany straight away exactly what to do. And instead they're learning on the job, much like they're learning some of the lessons that China learnt from scratch again. And we don't need to do this. And third big thing for the rest of the world, you've got to get your population ready. They should be washing hands now. So we all need to get into this habit that whenever you're out and about, then wash your hands frequently. And with your other people, you've got to wash your hands before you make a meal, while you're several times while you're making a meal, after it. You've got to wash your hands before eating. You've got to wash your hands whenever it gets dirty, and you've got to wash your hands when you're coming in from and touching things, and it's washing your hands before you touch your face. And we've just got to get into these habits. You need to bring the population with you early, because things are going to change rapidly, and you also need to trust in the machinery to keep people up to date. We have new information, so you've got to do it this way. And that's what they're doing in China. They're telling their population, we've now got to do it this way. Now, in the UK, instead of building trust, we've got these media just saying to everyone, everything is hopeless. It's a pandemic, when it isn't. There's an epidemic, we can't do anything. This is the message you're getting from the media. We should have the message that they're saying here, we can do this. Change your mindset now. We can do this. And as a population, get ready. Get started washing your hands. This is what we should all be doing. And the governments should be saying, what can we do now as a top priority? Where are the hospitals that we can clear? How can we set up all the deliveries if we needed to close off a city? We need to be thinking about this very seriously. And we need to give access. We need to invite the Chinese experts over here to advise us and give us the benefit of their experience. And so there's another message, human side, of sense of responsibility and collective action, the war footing and solidarity between provinces. Response was he went one province after another, and they are still, although they've got all these cases to deal with themselves, they were sending everything into China, Wuhan, that they can spare. So with one of the governors, he just had sent 2,000 health workers to Wuhan to deal with the response there, because they all were well aware that you've got these big, as I showed you at the beginning, this big population in Wuhan. This is the priority. In the same way, we shouldn't be just leaving Italy to struggle away by itself. It's the responsibility of the entire Europe we should be sending health workers straight to Italy in order to help them deal with their response. We should be sending whatever gear they need if they haven't got it. We shouldn't just be leaving it to Italy to do this. And as the world, same with Iran, then we should be sending Iran whatever it needs. And just forget about the sanctions for this. Whatever your views on the sanctions for Iran, they need as a top priority experts, equipment, finance, whatever they need. they did everything that they can to prevent this and stop it, and just forget about the political differences. This is a human thing, and them solving it in Iran will containing it in Iran will help the entire Middle East, but the entire world. So we should be sending things to Iran. This is where it's happening right now. And then at the same time, WHO is doing what it can. It's now luckily got this $123 million from the EU Commission, which is double what it says it needs as an emergency to build up preparedness and readiness in Africa and in other places with weak healthcare systems. So that is already going on, and some of that, if Iran needs it, WHO will be doing that. But we need that mindset around the world, like the Chinese. This is a vulnerable place. We don't need to rush things to China. They've all got what they want. But there are lots of vulnerable places. South Korea, that's very wealthy, but still, there may be things that South Korea needs. It's one of the top that be prepared already. If they, for instance, run short of health workers, they haven't got enough trained people there, then send them from Japan. If you're in Japan and you haven't got many cases yet, then send your health workers to South Korea. Speak very similar culture, not that similar, but they've got a lot of contact, back and forth contact between the two. And anyway, so you've got to get your population ready and bring your population with you early. So we should be doing this. So that's part of the reason also why the WHO is so strong in fighting the misinformation. All these people going around saying that China has got hundreds of thousands of people dying and that there's an epidemic spreading all around the world. We know that's not true. Absolutely. Look at Singapore. In Singapore we've got 89 cases. I think it is 91 now or something. And it's just increasing very, very slightly. But Singapore has got, everyone is tested with, he's got a bit about this in a minute, so I'll come to it. But everyone is tested in Singapore if they've got any kind of respiratory symptoms when they go to a doctor or clinic. Then they get a swab and then goes off to the labs, and then they automatically test it for many viruses, and they've added COVID-19 to it, and they're all coming in back negative, apart from the known containment chains. So no, that's a totally fake, new, false rumour. And epidemiologists who've just never been to China and who are just spinning out ideas based on their ideas coming probably partly from flu. They're just not right. So anyway, a real impact that you can change the course of the disease takes a very aggressive and tough program. And in 30 years, he's not seen this before. He's not sure it would work. Or have I gone through that? Have I been repeating myself? Oh yes, no, I've not. And how do you run a thing? And then he repeated himself, and they ran through it, 1, 2, 3, 4, how to run this at scale. Lots of really good learnings, and the form we're trying to do with this response. Oh yes, here we are, this bit about how much transmission is going on, tips of icebergs. So he's trying to look at this, and he talked about all the people who are very tired, and there's a huge fog, like the fog of war. And there's something called the influenza-like illness surveillance system that they have throughout the world. And you can look at this data in multiple places, all these flu-like cases coming up, November, December. And so if you go back in China, look at them, and he tested all of those, and nobody found it. Lots of flu, but they didn't find any of the COVID-19. So they got these old samples that they preserved from this surveillance system. And they could just go back and test them. And that's from November, December in 2019. And it wasn't there. And then they found it in January, but out of Hubei, it was still very rare. And then, at the height of it, then they have these fewer clinics. They tested 320,000 cases. And at about 0.49% was the prevalence of it at the height of the outbreak. Now it's 0.02%. So this again is absolute proof that it's going down hugely in China, and that's impossible with an epidemic unless it's being controlled. And it also shows that not huge numbers of cases being lost. This is like total proof it's not an expanding epidemic. They're not hiding an epidemic. They really have done what they claim to do. They have stopped it in its tracks. So the data that we do just don't support these various papers by these academic epidemiologists. And there was one just on the very day of this report. The day he gave this press conference, I found it nowhere. In none of the big newspapers was there anything about this press conference, just in some very obscure places. And what they did run was a story that the CDC, a false story, and the CDC said that it was impossible to stop it in US basically, and another story by an epidemiologist who said that 60% of the global population is going to be infected. And that's what the news, our global media was running on the very day that he produced this, that he did this press conference. This is an incredibly positive result. We need to turn this around. And please share this video. I know I'm being a bit, if you don't like sharing the original video, and if you find this is more informative and helps you understand better, then do share it and tell other people so we can do our little bit to make it clear what's going on. So, or go and explain it yourself. Explain it in your own words if you're a good communicator. Tell everyone. Write articles about it. Everybody needs to know this. So, so now a few more things. So the data doesn't support this idea. There may be a few asymptomatic cases, but it can't be a huge number. And it's important when at war to see your enemy. So another important development is seroassay. I've misspelled that. And so that's antibodies. They have just come up with a couple of new antibody tests in China. They're not quite ready, but they're soon going to roll it out. And then this will allow them to do community studies. So the value of an antibody test, so they've already got these CT scans, which is a quick way of discovering it before the virus, at a very, very early stage. So antibodies are not so much to do with that as testing whether someone has had it in the past. So that's very important for contact tracing, looking where a chain comes from. Who was patient zero? They don't know. In Italy, they don't know who patient zero was. They know who patient one is, but they don't know who he got it from. With the seroassay, they will be able to do that. They can go back and test all the people that he had contact with from when he was first infected, and they will find out who it was. So in a similar way with the seroassay, then they can also do community studies. And so one question is, China wants to reopen their schools. They're doing a phased reopen. First they're opening all their factories, and then they're going to open their schools. And so the question is this right? Should we open the schools? And the evidence so far seems to be yes, you can. It's not like flu. The children haven't got sick, or very few have. And it doesn't seem like they're the main driver. Not a lot of community infection. Community infection is when it's just being passed from person to person around the community, and you've lost track of the community, of the transmission trains. It's impossible to keep track. Like in a school, and children just mingling with lots of others, and it's not children they've got close contact with. It's just other people in the same class. This is not going on, and this is partly why it was so easy to and so it doesn't look like it. There's not a lot of community infection either in schools or anywhere else, at work or whatever. It's mainly household level infection. And that's part of the reason, that may be why China's strategy of close contacts has worked. Because if someone goes and visits your family, normally you know who it is, and you know how to find them. And when they go away, then you can tell them, oh, I know their name, I know where they live, I've maybe even got their telephone number, or their mobile phone number, or I'm in contact with them via email. Nowadays, there aren't going to be many people come and visit you where you haven't got some fairly easy way to get in contact with them when they leave. Maybe for couch surfing, I suppose, but even then you probably do. Indeed you would, for couch surfing, come to think of it. So yes, so it doesn't seem like it. So that's maybe partly why their strategy of close contacts works. Now remember, to stop an infection like this, you don't have to find everyone. What you have to do is find, so at the beginning it's got a reproduction factor of 2, that each person is infecting R0 of 2, each person is infecting 2 others. And that's why it doubles every 3 days. And but what you have to do is to find most of their contacts, most of the people that people are infecting. You don't have to find all of them. If on average 100 people infect 200 people, and then if instead you can trace the contacts and eliminate 180 of those 200 people, then those 200 people only infect 20. And those 20 will only infect 2, and then it's gone. So it doesn't matter if a few slip through the net, so long as you find nearly everyone. And so he's not speaking for the WHO, it's just that's what the evidence said. And then we had a big debate with Chinese colleagues, so you get these people around the world saying, who cares? So there's some people just saying, oh, I give up, and this is too hard work, who cares? It kills people, it kills just our elderly and sick, and but the young survive, and all is good, and we'll still be here as a human race after all that, and our industry won't be much affected. Indeed, we'll have less elderly people to look after, and less sick people to look after. This is not what a civilization should do. A civilization should stop something like this. And even if it's only a few, even if it's just, so it's only 4 in 100,000 in Wuhan, that's a figure that I know independently, that have died. That would be like 300,000 in the world. And it's equivalent to only a couple of days or so of people dying of natural causes. Even if everyone got as bad as Wuhan, it's not, and even if we didn't do Wuhan, it's still not huge numbers, because only 7 in 1,000, and most of those are elderly people and sick people. So the world would suddenly spin round and things would still be going perfectly well, even if we didn't do anything. But that is not what we should do as a civilized country, a civilization. He said, but the young survive, all is good. Seriously? And also, young people do die of this disease, and young people do die in industrial countries, but in much smaller numbers. 30s, 40s, and sometimes even younger people die. And then, sometimes people say to him, but it'll be much easier for us in the States or in Germany or whatever. We have this and we have that, and do they don't have them? Surely they don't have CT scanners, surely they don't have ventilators, so they don't have oxygen. But actually, in China, he said, if I have COVID-19, I want to be treated in China. He said, if you go into the hospital in China, you ask how many ventilators they have, they said they have 50 or 60. If you ask how many ECMO systems they have, that is a system that lets you oxygenate the body even if your lungs aren't working at all. And that's quite a rare thing, apparently. You don't have many in a hospital. And typically they have 5 in every hospital in China, and they don't have that in Europe. So if this came to Europe, big scale, we wouldn't handle it as well as Wuhan did. We would have struggled to find all the ventilators and all the ECMO devices if we had an outbreak as big as this. So luckily we can contain it quickly, then we're not going to have something like Wuhan. But if it did build up and become a proper pandemic, then we would really struggle to find all the ventilators, all the oxygen supplies, and all the ECMO devices, and all the people trained to run those things. The machines are no good without someone who knows how to run them. And rapidly training people to run ECMO devices in all our hospitals, and to quickly do CT scans and so on. And we should be planning about this, at least giving some thought to be ready for doing stuff like that, just in case that some city or other needs it. And again, we may be flying experts from China over to the UK to run our ECMO devices if it did come to like that, because we just wouldn't have them. And so when we need to look at that, China know how to keep people alive. They're super committed and they have a massive investment. And so, again, it's a case of commitment. How committed are we in Europe to keep very sick people alive when they're in a situation where they're gasping for breath, and then, how tempting would it be to just say, this person has had it and we have to move on to someone else. So the very strong commitment, just not trying so hard, and oops, they've died. So you have mistakes anyway in hospitals, so you have to be very careful. China know how to keep people alive, and they're super committed, massive investment. And we have already tragically lost people in G7 countries from this disease. So you wonder sometimes if the China numbers, the 7 in 1,000 that die in China, to give us a false sense of security. These people know and care about keeping these people alive and do it successfully. And he also mentions in another place that China has a very young population still. They're still growing up, growing up to, although they have a very high life expectancy now in their 70s, they still, it's not so long ago they had quite a low life expectancy, and they still have a very young population. In Europe, we have a much more aging population. Remember that 15% of those over 80 die, and a much higher percent die over 60. So we can expect a somewhat higher death rate just because we have more older people. In the same way with the Diamond Princess, once they've gone through all their cases, then they can expect a somewhat higher death rate because a cruise ship has older people in it. It's just the way it works. That older people tend to be able to afford it and also have the time to and really have a much more leisure once you've reached retirement, and then you go on a cruise ship to China or to Antarctica or whatever, something you've always wanted to do. So they can expect a somewhat higher death rate eventually once they've gone through with it. Anyway, so that's what he saw, and it helps to inform the global response, never black and white, reporting more, but reporting as more black and white can help to drive the global response. And I'm roughly taking about the same amount of time as he took with his presentation. That was about an hour in, but I'm explaining it in a different way. And I think he was probably a bit jet lagged, a little bit tired, and sometimes repeating himself a little bit. But on the other hand, I have also left out some technical details. I haven't said everything that he said, but I've picked up the key points as I was typing, and then I've listened to it again. I listened to it as I went through typing. I did some of the most important bits. And so now I'm just going to go through the questions as well. So he said, this was a question where he said, is China being successful in containing the disease? And the answer is they are showing success. He said, if I said they've contained the disease, they would have a fit, putting the cart before the horse. They haven't, but they are so close to success. They're showing success. And then I think that like I said, the main thing we can learn from China is this mindset change. That people think that you've got to get a vaccine, and all you can do is slow it down and then try and get a vaccine as quickly as possible. And the United States is putting $1 billion into finding a vaccine, but this will not. They won't be able to get a vaccine before the end of the summer at the very earliest, but most likely next year, most likely a year and a half from now. Very quickly, could be the end of this year, time for the next season. But for this season, no. So they absolutely have to. So it's really hard work too. It's very easy, just go around and just give everyone a jab. But it's very hard work to do all this contact tracing. And as he said, nobody else has this experience in doing it. We simply have never done it in the United Kingdom. We have never done this contact tracing on such a huge scale. Italy has never done it. So we have to have this mindset change, and we have to have this readiness, and just getting a couple of days early, being ready to do all the contact tracing very quickly on the spot right away with all the experts in place. Then that will save you precious days, which will save lives. Then also, the community has to come along and be with it. They have to be able to accept quarantine and rapid isolation. And materially can be, well, he said all that before. And then about the vaccines, we've got great candidates, but not out there working. So we've got these two, SARS and MERS, and we've got 4 other coronaviruses that cause colds, about a quarter of all the colds. And he said that the whole world of research in coronavirus is going to slaughter him. Because say yes, and they say yes, we are great. We've got all these great vaccines that we can use. They're just not using them. We could eliminate a quarter of all colds by giving people vaccines against them and developing those vaccines. But there just isn't the finance coming to deal with that. A cold is a minor issue for most people, but if you're elderly, it's more of a thing. And so, if we do actually produce this vaccine, it'd be the very first coronavirus vaccine that's ever been created, that they've ever gone all the way to actually producing it and using it. And so, we can do that, but we aren't ready for it yet. And there may be glitches along the way as we roll out our very first coronavirus vaccine, compared with the flu vaccine where everyone knows how to do it. The experimenters know theoretically how to do it. They've got these candidate vaccines, they're now doing the testing, and then they're going to do huge human trials, but they've never actually done it before. Not all the way. So, and then said, well, I'm not quite sure what he said there. I would have to retranscribe that. Anyway. Yes, so about healthcare workers. How do healthcare workers get infected? They found that although the doctors that got infected and so on at their work are the ones that hit the headlines, most of the healthcare workers got infected, then infected the other people, got infected in the community, not as healthcare workers. So we need a two-pronged approach. You've got to keep. Yes, one of the problems he explained is that you've got these two facilities. You've got the ones for the COVID-19, you've got the ones for the regular healthcare. And so if you go into a regular hospital and in fact you've got COVID, then a number of these, the reasons that medical workers are getting infected is because of people, you're pregnant and you have strange symptoms anyway, you're not feeling too great, you don't realise you've got COVID-19, you go into a regular hospital, or chest pain, trouble breathing, and you go in and you've got some condition that makes that quite a likely thing to happen to you. But actually it's COVID-19. You go in there and then you infect the other patients and you infect the health workers. So this is what you've got to do, is that you've got to look at how you're managing infection control, and it's not always in the obvious way. Sometimes it's this other way. And you've got to look into that. And again, we've got to figure this out in advance. And but most of the healthcare infections in China were early in the outbreak, before they figured this all out and realised what the problems were. And again, this is something the rest of the world can learn from China. And if they don't, they'll start making all these same mistakes themselves. And we'll get healthcare workers infecting the rest of the world for the same reason they were in China, just because they're not listening to what China has already learned. So again, it's the same message. We need to learn from China. They have handled this. They're the experts on this. Nosocomial outbreaks, that's healthcare outbreaks. Again, being an academic, he uses these academic words, and that may be part of the reason why people switched off. He kept saying nosocomial outbreaks, and what does nosocomial mean? Just a typical academic, and he explained what it meant the first time, and then after that he kept using the word, and just assumed that having explained what it meant once, that people knew what nosocomial means. And it means an outbreak in a healthcare facility. And that's part of the reason why people just didn't get what he said, the general public, because he spoke as an academic. I was trained as an academic, so I'm used to this sort of thing. So anyway, the whole thing with flu, we've already talked about that. It could be people's recall or bias, but it's an interesting insight. And he was saying that this is something they can test, whether children do infect others. They didn't find a single example where the child was the index case, or a transmission came, or that a child had led to infection of an adult. They don't know why, but this is something you need to. They said that science is not yet science finding; it's an observation that can be tested. And oh yes, this is the bit I explained in the nugget, that he went into a fever clinic. He didn't actually go into the fever clinic because it would make himself a contact, and he wouldn't be able to come back and speak to us. But he could see where it started and where he went in. And he saw this woman there who explained the various stages, explained how they were done, so impressive, and the CT scans and everything. And he said he acted like an IPC expert, and he asked her, are you an expert on this? She was that good that someone who was an absolute expert on diseases asked her, are you an expert on the diseases? And she said, no, I just learned, I'm doing something else, some very ordinary job. I just learned what I needed to do. And earlier on in this, people were caught in the war without the right equipment. People came with tons of equipment, and everyone who comes had to be self-sufficient. He couldn't go in and use their equipment. He had to get his equipment from Beijing. And he found this discipline everywhere. He brought his own isolation garments and everything. So if you are an expert and you visit Wuhan, you can do it safely. Most people can't. If he'd been anyone else, almost anyone else, and he visited Wuhan, he would be just stuck there and he wouldn't be able to return. But he was very, very strict in what he did. He washed his hands every few seconds, he said. And he kept, when they had their cafeteria and when they had their meals together, then he said each person in the team sat at a different table 2 meters away from everyone else. And he was a bit hoarse with shouting, and whenever he interviewed people, the other person would be 2 meters away, so as to make sure that he could never become a contact. So he'd just be shouting all the time. He never went up close to some person and talked to someone. He was always at 2 meters. And always washing his hands. And that is why, when he gave this press conference, people asked him, you gave this press conference, what are you doing giving a press conference? You've come back from Wuhan and you're not wearing a mask. If you saw the press conference in China, he did wear a mask, but presumably he was required to do that. But he didn't need to. And he explained, I am not a contact. If I was a contact, I wouldn't be here. I wouldn't be here with a mask. I just wouldn't be here at all if I was a contact. I'm not a contact. I've been tested negative. I never did anything that brought me anywhere in contact with anyone. Now, this is quite reassuring for if it ever happened that I am in, I'm talking with any of you thinking of you as I, then so you can think, if I am in this situation, like if I was doing this from Wuhan, I would have no concern at all, so long as I followed these procedures exactly as they describe. Then I would know I'm safe. This is not airborne. You can only get this from droplets. You can't get it just from the air. And droplets from someone coughing and sneezing can only travel 2 meters. If you are more than 2 meters away, you're just not going to get it. If you follow the advice they're doing in Wuhan and staying at home, and nobody in your household has it yet, and you do, and you're very careful with everything, you're just not going to get it, and you're safe. And so he did that, and he's safe. He knows that he's safe. So that's something to bear in mind, that if you've got an elderly person you're concerned about, then as long as they do everything that is required, they're not going to get it. They're simply not going to get it. If you use proper hygiene and you keep a distance, you don't need to wear a mask. The mask is to protect others. Unless you're a healthcare worker and you're doing things like putting tubes down their throat or something, and then that can lead to kind of things spurt out of stuff. I don't know, or if you're doing something that could lead, I'm not sure if that's the right procedure. He described some procedure that would lead to a great burst of stuff going out and filling the room. So if you're doing that procedure, then obviously you need full containment. It's not airborne, but there's lots of droplets everywhere. But anyone else, that's why the healthcare workers need all this gear, because they're in very, very risky things they're doing if you didn't have the gear. But ordinary people don't. You're just not going to get it if you're safe, if you use the right behaviour. And so so one of the big problems if with flu, all kids get sick, the parents have to stay at home, and then they can't do their jobs, and they lose billions of dollars from the economy because they're looking after the kids. This didn't happen with this disease. The kids got such mild symptoms that the parents didn't need to look after them. So anyway, that's that. So now we've got this thing about, with great efforts to control, it's resuming its economy. So how is that working? I said, first the regions are prepared. They've done phased reopening of factories and managed the risks as they open more and more. So they open first the most vital factories, and while they're doing that, they learn what they have to do in order to open a factory safely, and they pay special attention to that. Then they say, well, I'll open all the cement works, say, or whatever it is, and they're just doing a phased reopening of the steel works, and one person, and then there's this matter that in China everyone has got mobile phones, and so and then you get a certificate that's valid for 3 days, and then you could go to the next city, and if you're a migrant worker from this particular province, then the little video that you'll get on your mobile phone will tell you what you have to do. And so 5 million people with migrant workers go through the system with apps in one province. People have to work, life has to go on, and power response as well. So again, we should be thinking about that. We asked a question about why he didn't, so he's saying it's a serious disease, tens of thousands of cases, that's a lot. Yes, that's part of the Asperger explained all that. Oh yes, a little bit more, he said, a little extra detail. In multiple provinces they sampled 10,000 people or 50,000 people in regular hospital clinics, opportunity testing of people with symptoms of respiratory disease, found a very low proportion had the virus. And in Wuhan, they didn't want any transmission, they went house to house to check the temperatures, and again, they're not missing huge amounts. Asymptomatics just don't seem to be part of the picture. So in Wuhan, they have a pretty clear idea because they're just going around testing everyone for their temperature, not even waiting for them to have fever symptoms or coughs or complain. And also, as I said, we had no contact with patients' contacts. Zero, and washed his hands every 3 seconds, he said. Seems a bit surprising, maybe I misheard it. And wear a mask every so many seconds. And he shouted, that's all, I explained that. And the restaurants all closed, and the meals in the hotel rooms. And sometimes in the CDC cafeteria, one person at a table, and not allowed to sit next to each other. And then and then you had to use microphones to run a meeting, everyone distanced 2 meters apart. The hospitals were the clean section and dirty section and grey zone, and he never went into grey or dirty sections. And right through Beijing, anyone back from the province had automatically 2 weeks quarantine unless in transit. And he negotiated how to do that. it comes back to science and evidence-based approach. He said if there was any risk he would not be here using a mask, I would not be here. I'd not just be using a mask between you and me and you guys. That makes no sense. I just wouldn't be here. So how it starts and manifests. 88% had fever, 68% had a dry cough, 4% had a runny nose. It's not an upper respiratory tract infection, it's a lower tract infection. But a couple of days before you get the symptoms, you feel fatigued and very unwell. And if you think you've been exposed to someone with and you have prodromal malaise, that's this being very fatigued. Someone else described it as feeling like a truck has hit you. But you might think that just because you were doing too much the previous night. And aches and fatigues and dry cough and fever. And I've said all that. What's the view that millions are infected? Oh yes, I didn't go to every case, and every I told you about to use multiple data points, that's just the same thing. He's already said that. This person couldn't have been listening to him. Is an oral vaccine in preparation, 2 treatments. Oral vaccine doesn't have information, I didn't say have the answer. Treatment trials, double-blind trials. Puts a timeline to get the answers. And he said that people doing multiple trials and trying to get answers as quickly as possible. And he couldn't, he didn't ask them lots of questions. If you ask the wrong question, you can skew the trial. So he wasn't interrogating them much. And then people ask, is it working? Well, people are doing, it's a double-blind trial. And the people who are doing a double-blind trial have no way of knowing which is the placebo and which is the real drug that they're giving to patients. So they don't know until it's over. So the experts themselves that are running the trial, they just don't know which patients are receiving the drugs. So we won't know the results until the trial is over, about several weeks from now. There's no way to do it now. So why did Wuhan have a higher mortality rate? And so they had a 4% mortality rate for Wuhan and 0.7% mortality rate for the rest of China. So that's 7 out of 1,000 compared to 40 out of 1,000 that died in Wuhan. So there's several reasons. First, it happened at different times, so very early. They've been through the 7 guidelines, he said, was it 6? I can't remember. So a lot of things in the first 2 guidelines that they hadn't found the best methods of dealing with it. And so people were dying, and now they're not, because they know how to stop that. And then at the beginning, they were finding the severe, so now we've got extreme care, and a lot of, at the outbreak, at the start, they're finding severe disease, and now they're getting more of the mild disease, and get isolating them, not let them stay at home. And that is what is spreading it. Letting them stay at home, even in Wuhan, was what was making it spread. You have to get them in and more sight on the people who actually have the mild disease. So, same number of people that die are still dying. We have to be careful how we interpret these numbers. And so, how would it play out in Europe? And so, first of all, he's going to be very careful as an academic in giving this advice. He hasn't been to any other country that has been managing this thing. He went to China straight away as his first one. He doesn't want to give judgment calls. He said North Italy acting on scale to try to manage it. And this tells you what it can do. This happens in Italy or North Korea. And I keep hearing people say, it's not, there's haven't been, sorry, maybe it was South Korea. There's nothing, I was typing very fast. Anyway, there aren't any cases yet in North Korea. And they have very strict containment, and you don't need to worry about North Korea. They have all the cases turning negative. They have quarantined the entire country from the rest of the world. Probably easier to do with the sanctions. They have possibly some cases in North Korea in one province that is close to China, and they're keeping a very close eye on that. But all the studies are coming back negative. And the WHO are in China, and they're supporting it just like in any other country. Again, this shows no borders. WHO doesn't have borders, it goes everywhere. It'll go to North Korea, it'll go to Iran, it'll go to anywhere that needs help. And these people welcome them, because they know they're not coming there with a political objective, they're coming there to save their people. We've said all this. You've got to have all that. He's just repeating himself. People will ask him questions. I think some of the people in the media just weren't listening to him during the talk. This is quite common. Maybe he was a bit, maybe because he was such an academic and they weren't listening. They just asked lots of questions that he'd already answered. That's not uncommon in these press conferences. That's just stuff he's already said. Question about antibodies. A license within the last 48 hours. I heard the 2 were licensed. You need to do AIDS stratified. Yes, he's talking about. I need to Kenny talked about that. I think in the talk. And then he said that provincial CDCs make a lot of. And then what does Sadie think? Sadie, I can't remember her name. And children. That. And why could the mortality? I've already said that bit. And yes, are we ready to manage these things? Do we know the disease? It's not flu. That's the most important thing he had to say. It's not flu. Don't accept the sense of inevitability that you can't control, contain this virus. I think Dr. Tedros had an intuitive sense, and he did. I've been watching all the news press conferences from the WHO, and right from the beginning, Dr. Tedros was saying this. He had an intuitive sense, even though the experts were saying that China couldn't contain it, and he was supporting China right from the beginning. He had an intuitive sense that what China was doing was the right thing to be doing, and he said that what they saw, definitely supports it. So Dr. Tedros is very, very experienced. He's been the head of WHO, and he knows a lot about epidemics. So it's no wonder he's got an intuitive understanding of things. And he said he really worries about the lower income countries that don't have ventilators, isolation capacities, oxygen supplies, and these are what we need. And about babies. Young survivor, 2 months old, survived the disease. And he said that the adults had all become infected, and there's a 2 months old child and the grandparents been infected, and the team of nurses, when they looked at the baby, there was a little note in with the baby saying, please make sure she survives this. And that was their priority. And the team of nurses took care of this little child, and she survived. But the babies, they're not much of it. They're very a little risk to the children as it actually happens. About rapid diagnostics. And China delayed some areas spread. Alright. Recommend, and just to know about that's not very important to us. And the effectiveness of the Chinese medicine and how much can be reproduced. So Chinese medicine, he said, was striking how prevalent traditional Chinese medicine, TCM, was. 90% of patients got some TCM. Again, this was him being academic. He just said traditional Chinese medicine, and then afterwards he called it TCM. Traditional Chinese medicine, that's what academics tend to do. 90% of patients got some TCM, used a lot. And I think a lot of people may not have realised what TCM was. Even though he explained it, he only says it once. And physicians, a lot of confidence helps with mild cases. So just a little bit of absent-mindedness, and then he starts talking about TCM, and you have no idea what he's talking about. And that, media press conferences, they just don't have that attention to detail that you should have when listening to academics. They expect it, and he's not properly adjusted to talking to the public, I think, even though he must have a lot of experience of it. So I think a lot of it is the anti-inflammatory and the antipyretic, bring down the temperatures, That is why should the traditional Chinese medicine be helping. It's anti-inflammatory and temperature reducing. And this they got the intuition that the Chinese medicine is helping. And then also, if you're in China and you're used to traditional Chinese medicine, then it takes away a lot of the anxiety. So whether or not it's actually working, then it's a placebo, it's helping, it's taking away the anxiety. They're going to feel it's familiar. Oh, the doctors in the hospital, they use the traditional Chinese medicine just like my grandma said would work. And so I'm getting the right treatment here. Especially some rural person or whatever. They go, oh yeah, these doctors, they're the right sort. They give me such and such a route, and I know that's good for me. And so I'll take the other medicine as well. And so there's a bit of that as well. But that would actually make them feel better just because of the placebo effect. But they're trying to do double blind. There's a problem with the TCM that they're not doing very many double blind experiments. So it's difficult to know if it's a placebo effect or if it's really doing something. But I think they might be doing some double blind experiments. And so, yes, they had a task. Every ministry had that. They put all the ministries. So if you've got an agricultural ministry, then all the machinery of the agricultural ministry is being used to support this virus. And they're looking, what can we do with our tractors? What we can do with our trees in field forestry? What can we do with all our equipment and all our gear? And have we got any spare buildings that that we could use for quarantine, or anything that we can do within our sector? So they would just be doing everyone working together. He didn't give any details. I'm just making things up there, but if you look at the report, I'm sure it'll give details. So I have to be careful where if I go into a little digression, I will tell you. So there's nothing on that list that we can do all of that everywhere else. So will it be replicated elsewhere? Or is this a message for another part of the world? You are the masters of your own fate. Can it be replicated? Why not? There's nothing on the list on how to do that. Nothing on this list of things they have to do that countries can't do. We are the masters here. We call the shots. We make the decisions. And we can stop it. And really, if the journalists were just to come behind this and present this message. So as I say, on the day this report came out, there was not a single journalist in the BBC, New York Times, Reuters were there, but I couldn't find anything on Reuters. If there was, it was hidden away and nobody was sharing it. It wasn't on the news as far as I could see. Just nobody was saying this. And I'm absolutely astonished. It's the most positive thing we've got. It's the most important thing we've got. The most important statement ever since the beginning of the outbreak. And it's just not being said. Now, having said that, I'm sure the medical health professionals around the world are aware of this. And the people in the health industry, they should, and if the health ministers don't know this, they should be told it by their experts. But it should be everyone should know this. The general public, the government, everyone should be getting behind this. And we're not seeing this yet. And the more we do this, the faster we can respond, the more we can stop this ever getting anywhere. And so what happens? The report goes to Tedros. And it's not very, I'm just quickly reading and seeing if there's anything here that we need. We have psychological care so that's another thing you have to bear in mind, the psychological care of the team and the patients and the people in quarantine. And this sense of helplessness that a lot of people have in the West, in the face of a virus. This is 21st century and our science is incredible. And seen country use war footing and really fundamental principles in absence of a vaccine, they can do it. And an important part of the factor that people became highly sensitized to is the average time from onset of symptoms to hit the hospital. In the very first period it was 15 days, and with R0 equals 2 interacting with more people. In China it's now down to 3 days between starting to feel sick and being isolated in a hospital bed, and that is why cases are dropping fast. So you're still going to have some chance of being passing it on, but being around in the community for 15 days is very different from only being around for 3 days. If you can find these people quickly, right away. And that's why, if they've got an outbreak like in Italy, if they go into contact tracing straight away, the very moment that they hear there's an outbreak, then you've got 1,000 people already off doing the contact tracing. Then you find everyone that very day. Then you've saved 1 day of them infecting other people. And that's why it's so important. Every day matters. And then how about conflict areas in developing countries? And as I say, you talked to Dr. Tedros about that. He said that's what keeps him awake at night. He knows the reality of Africa and a tremendous responsibility. And he's trying to get Africa better prepared. That's why he went to China as the first wall of defence. Escalating out breaks down in industrial countries, and we are the second level of defence. The real vulnerability is Africa, it's not Europe. So the main concern for Italy is not it spreading to Germany or it's spreading to the United Kingdom or it's spreading to the United States. The main concern for Italy is it spreading to Africa. The main concern for Iran is it spreading to Africa. So we should be making sure that the Italians' cases don't spread to Africa. One Italian case spread to Brazil, and that's an example of their concern. Brazil, however, Dr. Tedros explained, has actually quite a strong healthcare system. So they have good healthcare, but not everyone has it. But they also have a very, they have all lots of equipment and things, they can do the tests. And they also have a whole network of fever labs, and they're very experienced in dealing with epidemics. So you might think that Brazil is the worst place to be hit. It isn't, it's Africa. And they see South America as being actually quite strong. So don't be so concerned about the case in Brazil. And remember, most places, then they have just 1 or 2 cases and then it stops. India has only 3 cases, they've all recovered, it's never gone any further. So anyway, what keeps him awake at night is Africa, especially the conflict regions of Africa. So then, for peace collaboration, get ready and buy more time and use the time well. He says we are not using the time well enough. This is the time for a Manhattan Project, multi-government vaccine trials. Now, that is one thing. So we heard that the United States is going to put $1 billion into vaccines, and other countries should be doing that. This is not going to help these are not going to help now, it's going to help in the future. And get ready and buy diagnostics and therapeutics, and I've talked about the rest. And that's it. A list of studies to go to China. Need household studies and serological studies, and use the time you have well, and this is going to save lives. So, I've covered nearly everything I've said. It's 20 minutes shorter, and that's partly because I skipped some of his questions which weren't directly relevant. They're repeating. The people asking questions lost a bit of time by asking him things he'd already answered during the talk itself. Anyway, so let's do a quick summary of the main points. So the main point is that we have to get ready. We have to change our mindset, and we have to recognize this can be done, and we are totally masters of this. We are the masters. We could decide. And with our decisions, we can definitely stop this. And there's no way, if we make the right decisions, if we are as determined about it as China was, if we put all the resources in, then as the second line of defence, Europe can stop it. And then, if Europe can stop it, then Africa is then the main concern. And we absolutely have to stop Africa getting it. And because if it goes to Africa, then it'll come back to the rest of the world again. So you're concerned about Africa for its own sake, because if it got to Africa, then they don't have hundreds of ventilators and CT scans, and they don't have these ECMO machines, probably hardly at all. And if you're in a rural area of Africa, then it's going to be very difficult even to quarantine someone. Where are you going to find your quarantine facilities? And it's going to be very difficult in Africa for the healthcare workers to protect themselves. And if healthcare workers get infected, then so we need to rush support to Africa, and that is what the WHO are doing at the moment, right now, because they've got the funding to do it, thank goodness. So these are the two positive things that have happened early this week, and neither of them were reported in the mainstream press hardly at all. So Africa, the WHO now have the funding to rush support to Africa. We have got this incredibly positive result from China, these absolutely extraordinary graphs, that in all of his history, in all of his work as an epidemiologist, he has never seen anything even remotely like this. And this totally proves, if you're an epidemiologist, this plus all the supporting evidence, we don't even really need it, this by itself totally proves that you can stop this, and we can all do that. We can all cause so that can be Italy. So none of us are going to be like Wuhan as long as we do this, because they just didn't know what they were doing. We can all be like, that's the whole of China. It's like that. So Italy can be like that. A fast start, but very quickly level off, and then die away, and it's all gone. And we can all do that. There's nothing in what China has done that the rest of the world can't do. And we are the master of this, and that is his central message that hardly anyone reported. And even there were few articles that just did a very, very sketchy summary of what he did, and they basically ended by saying it can't really work, sort of a thing. They just didn't have a clue. They just didn't understand what he was saying. Hardly anyone, I don't think many of the journalists who were listening to him, despite all their questions, really understood his central point, even though he made it really clear. Anyway, I hope that now, by listening to this, that you have understood. And all I've done, I've said exactly the same things he said, with a few little elaborations here and there to fill in gaps that you might know. All I've done is say it without the academic words. That's the only difference. I don't say things like TCM or nosocomio, which turns people off. That's the only difference. Anyway, we can do this.